More than 300 million people do not have access to healthy water throughout Africa. In sub-Saharan Africa, 59% of the population lives on under $29 a month. Contagious diseases and insufficient health services are a basic problem. Out of 36 million people in the world who carry the HIV virus, 28 million live in sub-Saharan Africa. 2 million children a year are dying of polio and malaria alone. 1 out of every 6 babies dies before reaching age 5, and 10 million people are blind waiting to see the light. Wherever there is a spark, it burns us. Whether it is in Mozambique, Somalia, or Mali. The most beneficial people are people who help mankind.
Açıkça, özgürce ve namusun üzerine ant içerim.
Such a great vow this is. The doctor profession is an answer to the prayers of those who pray for a cure. The doctor profession is loving mankind because of loving the Creator. It is being able to hold the hand of others through birth, in war, in earthquakes, in drought, in sickness, in death, in times of difficulty. Is the voice and breath of the over 3,000 health volunteers, 19 member organisations and health workers of the Aegean International Health Federation. Accepting the slogan, "Until the world is well again," as their mission, Esafed realises projects in the field of health on a national and international scale. Hospital management training for chief physicians in Yemen. The Cataract Project and circumcising 10,000 children in Sudan. Closed surgery training in Egypt. Branch experience training in Mali and Cameroon. Approach to emergency medical response training in Cameroon. Emergency medicine training in Tanzania. Health scanning in Nigeria, Kenya, Guinea-Bissau, Pakistan, Libya, Haiti, Ghana, Mozambique and Somalia to treat thousands of patients. Operations and distributing tons of free medication are part of these projects. While Esafed was coming to life in 2011, hundreds of thousands of people were dying in Somalia due to drought and illness. Esafed took immediate action against this drama of humanity by extending a curing hand to this suffering country with a number of large-scale health projects. Aware that in addition to the humanitarian and medical aid provided by the hundreds of volunteers, a more permanent solution in the form of training would be most beneficial, Esafed took the following steps to compensate the deficiency of specialist physicians in Somalia. Initially, a specialty physician legislation and curriculum was prepared and submitted for acceptance by the Somalian Ministry of Health. In this context, 25 doctors and nurses were brought to Turkey to start the first stage of their training. The Esafed speciality in medicine training is continuing in the Deva Training and Research Hospital, which was commissioned by the Kimse Yok Mu Is Anyone Out There Foundation. Focusing on the fact that the average of mother and child deaths are much higher in Somalia than the world average, Esafed has provided theoretical and practical training on important subjects like healthy mother training, NRP training, neonatal training. While projects centered in Somalia continue in Eastern Africa, other projects have been started in Western Africa, such as our completely equipped mobile eye clinic, MEC, centered in the Republic of Mali, where cataract operations are performed. Esafed has gone to a number of countries in Africa that most people do not even know the names of to carry out a variety of tasks, and over 100 people employed in the health industry have been brought to our country to be provided with training. Esafed also carries out the following tasks in response to needs in our country and the demands of members: youth awareness, healthy generation projects, on-the-job training for the family physician profession, a health-only workshop, branch-focused seminars, a variety of social activities, scientific work, workshops, panels and conferences. Esafed considers responding to the needs of each health employee member its duty and therefore forms the necessary boards to conduct the necessary group work. With 19 organizations and over 3,000 volunteers, Esafed works in coordination with 5 health federations to realize even larger projects on an international scale, and is a founding member of the International FIFA Health Federation, FESCOM. Esafed sincerely thanks all volunteers who have devoted themselves to the work that is done by Esafed. Until the world is well again. Esafed.